Good morning and welcome to Between the Beats. We are here with Dr. Rudrani Banik. We live in a screen-dominated world, and with most Americans spending 7 to 9 hours a day staring at devices, the result is digital eye strain is now an epidemic. It causes blurred vision, headaches, and even fueling a surge in nearsightedness, especially in children. But you don't have to sacrifice your eyesight for technology. Joining us today is integrative neuro-ophthalmologist Dr. Rudrani Banik, going by Dr. Rani, here to share some simple ways to protect our eyes and keep our vision sharp in the digital age, and also tell us about the Eye Health Summit, which happens in May, first week during Healthy Vision Month. Good morning, Dr. Rani.
Good morning.
How are you doing today?
I'm doing very well. How are you?
I'm good, thank you. Where are you calling from?
I'm located in New York City, right in the heart of Manhattan.
Oh, I love New York City. All right.
Yeah, it's a wonderful place to live, but also to visit.
Yes. I would like to go back. I lived there in about 2011 or so it's probably changed by then since then. So
It's probably gotten more busy.
Yeah.
That's probably what's happened.
Well, thanks for joining us. Can anyone develop vision problems, or is it just something that happens as we age?
Yeah, that's a great question. Many people think that vision issues only develop once people get older, let's say past the age of 50. But the reality is it can happen at any age. I've seen even kids, even babies with vision issues. So the most important thing is to just be aware, get checked out, go see your eye doctor on a regular basis, and try to ward off some of these conditions like dry eye, cataracts, glaucoma, macular degeneration. All of these happen typically later in life, but some of them can even happen earlier. And the best way to manage it is prevention.
Okay. Dry eye is becoming more common, they say. What causes it?
Yeah, so there are different reasons, but the most common reason in over 85% of people with dry eye is that their tears simply evaporate too quickly. So when we blink, our tears coat the surface of our eye, and then if we're not blinking enough, the tears begin to evaporate. And that leads to ocular surface issues and symptoms like blurriness or a scratchy sensation or a gritty sensation. Sometimes the eyes can get red. So there are some great ways to manage dry eye, which involve simply just blinking more, but also including some nutrients that help support dry eye, particularly the omegas. For example, omega-3s have been shown to help with dry eye symptoms.
Oh, interesting. Okay. And on the intro, I mentioned nearsightedness, which is also called myopia. And in children, what is that about, and how do we prevent that?
Dr. Chaz, this is also an epidemic in our world, myopia. Myopia is nearsightedness where people can see up close but not go far away, so they need glasses or contacts to see far away. And the rates are rising, really exponentially, and we think that by the year 2050, 50% of the world's population will be myopic. It's really a crazy, staggering number that 50% of the population will be myopic. We don't know exactly what's causing it, but we think our increased demands up close, meaning we mentioned this earlier, that being on screens can lead to symptoms of digital eye strain, but that may cause the eye to lengthen in shape, particularly during childhood, and it may be contributing to myopia. So yes, it's a problem because later on in life it can lead to other things like glaucoma or other retinal issues. So really we need to manage myopia. And there's some really simple things people can do to avoid it. So easy. Well, the main thing is to take breaks. When you look at screens, we're on screens for hours and hours. If you just take frequent breaks, I like the 20-20-20 rule, which basically means every 20 minutes, take a 20-second break and look at something 20 feet away. So you're not looking at your screen. You're giving those eye muscles a chance to relax. It's a simple way to manage screen time and help to hopefully reduce myopia progression.
Oh, that's great. And I guess we can have our kids do that too. We can set an alarm and say, look up from the screen, kids, if they're doing something like that.
Yeah, I love that. I tell my patients, set your timer on your phone or device, and every 20 minutes, take that break. And also for kids, this is also something really important, and it's also science-backed. We know that when kids spend about 2 hours a day outdoors during the day, that reduces their risk of myopia progression. And this has been shown in studies mainly done in China and Taiwan, where myopia rates are really astronomical. And so there, they're mandating that kids be outdoors for 2 hours a day during their school day. And there are some countries also that have mandated this, like Denmark, for example. It hasn't quite happened in the U.S. yet, but hopefully soon we'll be more aware of getting our kids outdoors to help decrease their risk of this preventable eye condition, which is really, really so important.
Wow, that's really interesting how just some outdoor time can really, really help with that. How much screen time
Absolutely.
is too much?
That's a great question. And the truth is, most of our world is on screens, whether it's for work or for school, or maybe it's, watching our favorite shows on Netflix, or it's connecting with family and friends. We're always on our screen. So there is no set amount or set limit. What I would just say is take those breaks. And if you really feel like your eyes are getting fatigued, you can integrate some other methods as well. Like we talked about blinking more, including some omega, staying well hydrated to prevent dry eye. Also, many people think that they should be getting blue blocking glasses to help with screen time and blue light exposure. The truth is, this is really interesting. The truth is there is no scientific evidence that blue blocking glasses actually work.
Ah,
Yeah, it's it's really, when I say that, people are like, really? But what about, what my optometrist tries to sell me, or what my optician tries to sell me, those blue blocking tints? There's no proof that it actually works. Instead, there are many other methods you can use. And this is a really hot topic about managing screen time blue light. So we talk about this during the Eye Health Summit a lot. We have many speakers. We have 35 speakers in the Eye Health Summit, but many of them are talking about managing screen time and computer eye strain. There are so many great strategies that our speakers are sharing. So I encourage people to join if they haven't yet. Please join our summit. It's free. It's online. You can just go to our website, theeyehealthsummit.com, and you can register. Please encourage your friends and family to register if they want to learn how to protect their vision. It's a great resource, and it's the first time this is ever being presented to the public, and I really hope it's going to be a resource that people will turn to guide them in how to protect their eyes for the future ahead.
oh, that sounds great. Will there be recordings of afterwards, like if you have to miss one of the topics?
That's a great question. So the summit is free, but if someone wants to, if they missed a talk, missed a topic, they can actually purchase the summit package, and they'll get unlimited access to all of the recordings. And again, they can share them with their friends, family, with providers, so they can all be better educated. There is that option as well, but it is free. Hopefully you can all join. And we're also going to have live sessions. So, if you have a burning eye question, you really want to get that answered, you can join our live sessions. They're going to take place in the early evenings every day, and you can ask our experts your questions and get them answered. So it's a great way to get some advice going forward.
Oh, that sounds great. Could you tell us if vision loss is unavoidable, or tell us about prevention? And I know we're going to learn a lot of this at the Eye Health Summit, so I'm just asking for like a snack. So,
Sure. So I would say the number one thing when it has to do with prevention of eye disease, whether it's cataracts or glaucoma or macular degeneration, it really rests in your own hands. It has to do with your nutrition. There are studies to show that if you include enough nutrients in your diet, specific eye healthy nutrients like lutein and zeaxanthin, maybe some people have never heard of these nutrients, but they're really important for our vision, that you can ward off macular degeneration. You can ward off losing your vision and going blind, even by over 40%. So include lots of these eye healthy nutrients. We talk about them during the summit. We talk about them specifically on certain episodes, particularly day 5 of the summit. You want to tune in for day 5 of the summit when I have 5 experts that are going to be talking about some of these strategies. Also, I have a book. If anyone's interested in learning more about ocular nutrition, my book is Beyond Carrots, Best Foods for Eye Health A to Z. It's available on Amazon, so you can get it that way. But please, please, please join us for the summit to learn more.
okay, yeah, I read in your book a little bit of it that you went to a functional medicine doctor when you were having severe trouble, and the diet, of course, the food is medicine theory. I've been watching a functional medicine doctor once a month, and it's really something what food does to your body.
I'm a strong believer of that. Food is medicine. If you eat the right foods and avoid other foods, you also want to avoid certain kinds of pro-inflammatory foods in your diet to avoid not just eye disease, but overall disease and improve heart health and brain function and your immune system and gut health. I think the future of health is going towards integrative and functional medicine because we shouldn't just be putting a Band-Aid on our problems. We really should be trying to address them at the root cause and prevent them. It's really the message of our summit as well, is an ounce of prevention is worth a pound of cure. And food should really be the staple of that, the foundation of that.
Yeah, and I can't find it right now, but I read somewhere when I was looking at your stuff this morning, we always talk about heart health, brain health, but eye health is also interconnected in a big way. Could you touch on that for a second?
Absolutely. Many people have heard the phrase, the eye is a window to your soul, but the truth is your eyes are a window to your overall health. And there's so many systemic health conditions like diabetes or high blood pressure or heart disease or neurologic conditions like strokes and multiple sclerosis. We can pick all of this up on an eye exam. So really, your eye health is intimately connected to the health of so many other organs and organ systems in your body. So go see your eye doctor. This is another important message I want to get across is, we go for our annual checkups. We get our labs done once a year. We get our mammograms, our colonoscopies. We go see the dentist twice a year. But many people don't know that they should be going to their eye doctor once a year for an annual dilated eye exam because we can pick up eye disease, but we can also pick up systemic disease. So don't miss that annual eye exam. Get it on your calendar. Make it a part of your annual health checkups that most people oftentimes get.
Yeah, I made an appointment for a friend with an eye doctor recently, and she said, I recommend you do the whole gamut of testing because I feel pretty fine, and I did the testing, and the doctor said, I don't know, she had high blood pressure or something, and she would have never known, but it showed up on the eye exam.
Yes, and it's I can think of like countless patients I've diagnosed with simple things like high blood pressure, diabetes, and they had no idea that they had these conditions. But again, the eye is like a canary in the coal mine. If something is happening in a different part of the body, oftentimes it will show up in the eye first. Because the eye is such a delicate organ, it's very vulnerable to other types of conditions, whether it's high blood sugar, high blood pressure. So get your eye exams, please. Make that appointment today.
All right. Yes, and I encourage everyone to join the Eye Summit, the Eye Health Summit, and Dr. Ray is going to tell us the address again here in a minute. I don't think we think about this, but, there is cutting-edge technology throughout everything, and that includes the eye.
Yes, and we have had in the past, I would say, 10 to 20 years, we've had incredible we've seen incredible progress in dealing with eye health conditions. So we talk about all of that. We talk about the medical and surgical advances in eye care during the summit, but we also bring in a more holistic approach. So nutrition, lifestyle, mindset, stress reduction. I even have some speakers talking about acupuncture for eye health, homeopathy, traditional Chinese medicine. So we really want to bring the best of both worlds into the Eye Health Summit and really, show people what they can do, the many ways that they can support their vision health.
Well, that sounds great, and I definitely want to attend the summit now. So tell us again.
So it's our website, www.theeyehealthsummit.com. You can register for free, and you can see all our speakers, the day's agenda, so you can see each day has a theme, who's speaking, what are the topics. So if you can only tune in for a couple of the talks, great. If you can tune into more, that's even better. But there's something for everyone, and you may think that you may see a particular topic and say, oh, maybe I'm not so interested in this. I really don't think I really have a need for this. But you'll be surprised at what you'll learn. There are some golden nuggets that our speakers share in almost each and every talk that even I've been surprised at, and I'm like, wow, I never knew that, and I'm going to start incorporating that into my own eye care and into my patients' eye care. So really, there is just so much to learn and benefit from the summit. So theeyehealthsummit.com. Please register. Please join us.
Okay, thank you so much. And you guys check out her book, Beyond Carrots, Best Foods for Eye Health A to Z. I've read a little bit of it, and it's worth delving into more. So I appreciate you coming on with us this morning, Dr. Rani.
Thank you so much, Dr. Chaz. It's been a pleasure.
Thank you so much. Bye-bye.
Bye-bye.